Good morning, and thank you for joining us today for our weekly COVID-19 pandemic update. My name is Don Walker. I am the Communications Director for Brevard County Government. And on our panel this week, as usual, we have representatives from the Florida Department of Health, Brevard. That would be Maria Stahl, who is the Administrator, and also John Davis, who's the Community Health Director. We also have John Scott, our Emergency Management Director, Mark Schomeyer, the Chief of Brevard County Fire Rescue, Matt Wallace, Public Safety Director, and as always, we also have Jesi Ray, who is the County Social Media Specialist, who will be monitoring our Facebook Live event today for any questions posed by those who are watching our updates today. So as always, we'll turn it over to John Davis with FDOH for an update on numbers. John?
Thanks, Don. So some good news and not so good news. The good news is we continue to see a drop in our case rates from week to week. I think when the weekly summary comes out later today, you're going to see that we've dropped from a community of high transmission to one of substantial transmission. So I'm expecting we'll be below the 100 cases per 100,000. Again, I do want to emphasize the word substantial. So we still have a lot of virus out in the community. So we would continue to emphasize folks continue to mask in public indoor settings, seek vaccination if you haven't done so already. Social distancing, hand hygiene, all those measures are significant tools in this fight, and we encourage you to continue that. In terms of hospitalizations, we've seen a decrease in positive admits of COVID patients, about a 20% drop over the week prior. Schools are looking better. We're seeing the lowest daily case rates that since the school year began. We are starting to see some days where we're getting single-digit cases in school-age children at this point. The not so good news, vaccination rates essentially remain stagnant. We did do about 100 more than the week prior, but we're still at 67% of the county population of 12 and over that are vaccine eligible. For school-age children, 12 to 14 age, they're at 44% of vaccination. 15 to 19-year-olds are at 50%. So that only came up a percentage point in each of those groups. So again, we continue to urge folks to seek the vaccination. Also, the flu season's upon us, so encourage folks to also get vaccinated against the flu. You can get both those vaccines at the same time, so that's not an issue. So again, we encourage that. And that's my updates for this week.
All right, thank you, John. Our Emergency Management Office has been working very closely with the state and also Florida Department of Health on doing vaccinations and also the monoclonal therapy. I'll turn it over to John Scott with Emergency Management for an update on those programs. John?
Thank you, Don. And good morning, everyone. Again, my name is John Scott. I'm the Director of Emergency Management for Brevard County. I'll touch on a couple of things just to remind folks of the resources that remain available to them when it comes to COVID testing. Continues to be widely available across the county. We've seen supply now back in a place where it outstretches demand. In addition to our pharmacies, our urgent care centers, and our primary care physicians, which are offering COVID testing, we partnered, partnered with the City of West Melbourne, the Florida Department of Health, Brevard County Parks and Recreation, and Parish Medical Center to offer testing. Logan, if you could please put those locations up on the screen for everyone. There are 4 locations countywide where folks can get either drive-through or walk-up testing. With the exception of the Department of Health, they're all Monday through Sunday. The Department of Health is Monday through Friday. Again, the details are listed. Appointments are required at Parish and the Department of Health. No appointments are required but encouraged at Kiwanis Park and at City of West Melbourne Park, which is right next to the Field of Dreams. So again, testing is widely available for folks. If you're not sure, if you think you've been exposed, certainly if you're symptomatic, we encourage folks to get tested and make use of those resources. On that point, if you are someone who believes you have been exposed to COVID or are showing signs that are COVID-like, We also have available to everyone the monoclonal antibody treatment, which is located at Kiwanis Park. And there's no referral for that. There's no prescription or doctor's note necessary. You can go and get that. They are 9 to 5, 7 days a week at Kiwanis Park. Again, if you're COVID symptomatic, if you're COVID positive, or if you've been close contact to a COVID exposure, that is available to you. The earlier you go, the earlier you get that in your life cycle with COVID, the more effective it's going to be. So please don't wait to do that. And just a reminder, that is 4 shots, 1 in each arm and then 2 in the stomach, and then you'll be observed for about an hour. So plan to spend some time there. And if you are going to go, remember to hydrate beforehand and have something to eat. Those will make big differences in how you respond to that treatment. So that's, again, the treatment that's available for folks. Want to follow up on the good news we heard from the Department of Health today with numbers going down. That's great, but the troubling news is, our vaccine rate remains stagnant. So please continue to make that consideration, can talk to your friends and family, encourage folks to get vaccinated, and that is our long-term solution in all of this. That's our highest protective measure against COVID. The more folks that do it, the safer we're going to be as a community. But also as a reminder, you heard John say we're hopefully going to be a substantial community at the end of the day. It's still a lot of virus. We need folks to continue to wear face coverings when out in public in large groups or indoors where ventilation is not possible or social distancing is not possible. Practice good hand hygiene, and if you are sick, please stay home. Don?
All right. Thank you, John. So as we always do, we're going to field some questions from those who have tuned into our update today. I do want to mention that while we did get updates from Department of Health Brevard and also Emergency Management, we do have our Fire Chief, Mark Schillmeyer, here, and also our Public Safety Director, Matt Wallace. So if you have any public safety or fire rescue related questions, we can field those as well. I will turn it over now to Jesi Ray to pose those questions. Jesi?
Thanks, Don. So we have Melanie Holt from WFTV who asked, how long were we considered a community of high transmission before the recent decrease in cases to a community of substantial transmission?
So essentially, it was all summer long. So I don't have the numbers right in front of me, but I believe that would have been from mid-July onward up through today. We were a high transmission. And of course, in prior times, when this thing first started back in 2020, those rates were fluctuating throughout that time, but there were certainly times with the previous peaks that we've seen where we were, of course, a community of high transmission as well.
Gotcha. Okay. What are the school numbers per day? I know that is found on I know we don't have our school representative here today, but those are found on their dashboard that they update. But they did ask if it's in the single digits, why are students still told to wear masks? I don't know if we can't really talk much about that, John. I don't know if you want to.
I'll just say when it comes to that, those are the school board's decisions. I know that they're engaging very closely with the Department of Health to monitor those numbers and continue to take the best action they deem appropriate, and their board does, and we will always defer to that.
Gotcha. Yep. So the antibodies are only available at Kiwanis Island Park. There's no other locations that offer, here in Brevard County, that offer the antibody treatment, correct?
Parish was at one point doing it. I think they're back to doing it again. So too is Health First. I know there are some other doctors' offices that are doing it. The Kiwanis site, and the reason we highlight that the most is A, that's the state site that we entered into a partnership with, and B, that site is specifically for monoclonal antibody treatment. It's a easy, not necessarily appointment or no appointment required to go to, whereas doctors' offices and things like that, you would need a doctor's appointment and that kind of thing.
Okay. And the intravenous antibodies, are those more effective than the shots, or, I mean, I don't.
When you say intravenous antibodies versus the shot, I would imagine you're talking about the 2 delivery systems for the monoclonal.
That's what it seems like. I'm not really sure.
Okay, I would say, and I'm certainly not the scientist, so if anyone, epidemiology side, John, if you have thoughts, but I think either way, as long as you're getting the treatment, I don't think there's a large difference between efficacy, but
But should we clarify, though, at the Kiwanis site, though, it's only the shots,
correct,
correct?
yes.
Gotcha.
I would agree with that.
Okay. Has the vaccine mandate had an impact on the vaccination rate in this county?
Again, as I said before, we've remained fairly stagnant. So of late, I would have to say no based on that.
Okay. John, I think this one is probably going to be for you. How is the county working to educate residents about the impact of COVID-19? And do you or are you planning to physically go out into the community to make presentations to encourage people to get vaccinated?
Well, we've certainly been doing that throughout this whole pandemic. We've had members of our epidemiology staff that have been visiting long-term care facilities, other large private businesses in the community throughout this whole thing. Our longtime epidemiologist, Barry Inman, who most of you are familiar with, has given a multitude of talks throughout the community during this whole time over the last almost going on 2 years now. And we continue to message on our internet site as well as through the press releases we send out, and of course forums like this as well.
Hey, and Jesi, let me follow up on that. Just because I think when we talk about the impacts of COVID, we've gotten to a point where maybe we've lost sight of what those human impacts are in our community. And I think it's important we talk about what that means to the residents who have experienced either the worst case, which is being loss of a loved one, which no one wants to do, but we've had economic impacts. We've had folks who haven't been able to work because either illness or they're taking care of sick kids, or all the actual human toll impact that COVID has. And so when we talk about it in an objective and a data-driven way, there's value to it, but let's not lose sight of the emotional impacts. When we talk about what do we need to do to educate and talk about the impact of our community, I mean, our community is feeling that impact. And I think if we're not also talking about what that human toll looks like, and we're not talking about why that should be motivating people, we're missing half the picture. So I don't think we necessarily have to get out there and do it. Our community is experiencing the impacts of COVID.
Well, and I wanted to mention too, Jesi, that from the county standpoint, we've had a very aggressive social media campaign where we've told people, just about provided daily updates to them on where they can get vaccinated, where they can get tested, where they can get the monoclonal therapy. We've also held these Facebook Live events on a weekly basis, going on probably 16 to 18 months, whether it's on a weekly basis or on a monthly basis when the numbers had dwindled before we started our second peak. So we are doing, and there's also press releases that we put out. So we are trying to keep a high profile as far as getting information out to the public on the COVID-19. So.
Okay, thank you. So Brevard County government was able to have 80% of its employees get COVID-19 vaccines by offering a financial incentive. What kind of efforts are being done in the private sector locally to do this, and do you think financial incentives are a good idea?
I'll take that one.
Sure.
So the short answer is any incentive that encourages someone to get vaccinated, we're for. And like we've talked about for 18 months now, this is a community problem that requires a community solution. That's government, nonprofit, private sector, and us as residents. So anything that encourages someone to get vaccinated is a good idea.
Okay. Can you discuss the COVID-19 booster shot status and whether there is much of a demand locally for people who already are eligible to get them?
We certainly are seeing folks come in for their booster dose. I just want to emphasize there are some differences between the different vaccines that are available right now. So if you'll bear with me, I'll kind of read through this. But certainly at the health department, we're offering the Moderna, Pfizer, as well as the J&J. And that's Monday through Friday, 8 to 4 at our Vieira site. Our Melbourne site and our Titusville site are offering the Pfizer vaccine. That's also Monday through Friday, 8 to 4. In terms of the boosters, so with Moderna, if you've had Moderna at this point, the only authorization, and this is an emergency use authorization, is for the moderately to severely immune compromised to receive a booster dose of Moderna at this point. Pfizer is the same category, severely immune compromised, but in addition, those that are 65 years or older or reside in a long-term care facility, or those 18 to 64 years old with underlying medical conditions, or those age 18 to 64 with increased risk for exposure and transmission because of their occupation or institutional setting puts them at high risk, can get the booster dose at this time. Now, for the immune compromised, that needs to be at least 28 days from their first initial shots, their first 2 shots of Pfizer. However, if you're not in that immune compromised category, so you're at a high-risk facility or something of that nature, it needs to be 6 months out from when you've completed your initial series.
Okay. What are our breakthrough cases looking like here in this county? Do we have an idea of that data?
We've certainly seen breakthrough like anywhere else. The good news is that most of those folks do absolutely fine. Very few hospitalizations or deaths in that group. So the vaccines, again, we're never going to be 100%. However, they are good at preventing hospitalization, severe illness, and death. In terms of the numbers, we're right now, when you compare it to the over 300,000 that have been vaccinated in our county, I believe we're less than 2% at this point.
Okay. Are we experiencing a staffing shortage at any of our hospitals or medical facilities?
I'll take that one and just sort of speak in generalities. I think workforce-wide, we're seeing staffing shortages, and certainly our hospital systems and healthcare community is not immune from that. I'll continue to emphasize all of the good work that those on the front line are doing, and that those, they're making the changes and the adjustments necessary to meet the need. We haven't seen any issues where services have been compromised or anything like that. But again, I think that's a challenge we're having community-wide across the workforce spectrum.
Okay. And John Scott, do you think we are ready to respond to another surge if or when that happens?
Yes.
Okay, excellent. Now, I know that we talk about this at a lot of our lives. We've talked about it a few times. I know people don't like the answer, so they can keep asking us about it. But can we talk a little bit about herd immunity and what that looks like? Is it working? How does it work? Why aren't we relying on herd immunity? Why are we relying on a vaccine?
So I think the Delta variant changed a lot of that. The Delta variant is so highly transmissible that in order to look to herd immunity to get over that, you would need to be in the neighborhood of 85, 90% or so, somewhere around that range. And we're not near that. Even when you consider the cases we've had, in addition to all our vaccinated folks, we're still not at that range.
Okay, fair enough. Don, I think that's really all we have for today.
All right, Jesse, thanks. And since we have our Emergency Management Director, John Scott, with us today, we're going to go ahead and let John give us an update on a different subject, hurricane season. John?
Thank you, Don. Again, we always want to use the opportunity to talk about, Brevard County is unique in many ways. We are vulnerable to all kinds of hazards. In addition to the pandemic that we've been combating for these 18 months now, we are smack dab in the middle of the heart of hurricane season for us. Again, with September and October being our busiest months. I know folks felt pretty good lately. I'm certainly enjoying the good fortune we've experienced. But what I'm concerned about is the phrase I've started to hear in the community as well, hurricane season's over. Like, nope, not yet. We've still got about another 40 days to go in the season. We need to continue to make sure we're ready. And like we talked about last week, as we move into October and November, again, October being our second busiest month, we see storms come out of the Gulf and come out of the Southern Caribbean more, which means less time for us to get ready to react and respond. So we need to make sure that our plans are in place, we have disaster supply kits ready to go, and that we run through the tape, that we finish this thing all the way out. Hopefully, we continue to get lucky and have what is one of the busier hurricane seasons on record continue to spare us, but that can quite literally change in a matter of days. So we all need to be ready, we all need to be paying attention and ready to respond if we find ourselves facing a hurricane.
All right, thanks, John. So we've timed our Facebook Live updates kind of based on the numbers that were provided on a weekly basis from the Department of Health. As those numbers increase, we ramp up the number of updates we provide, going from once a month to once a week. And so when we finished our first peak, we kind of slowed down the number of updates we were doing until we reached the second peak, and we started doing them on a weekly basis again. Based on the current numbers that we have and based on the numbers we anticipate will be released later today by FDOH, we are going to, for now, cease the weekly updates, and we will tentatively plan our next Facebook Live update for November. We will put out an announcement for when that will be held, but we will continue to update the public as any developments occur related to the pandemic. We thank you all for tuning in. I do want to give a quick nod of appreciation to our team at SCG TV, Space Coast Government Television. Logan Hemingway, our production manager, and Anda Skambrax, our programmer, have been instrumental in helping produce these weekly segments. And again, to Jesi, Matt, John, Mark, John, and Maria, we appreciate y'all being here on a weekly basis, and we will talk again soon. Thank you.